I'm Joe Chille, and you can listen to me mornings on the Big Wack. Joining us on the Big Wack Buffalo on the Rise is Brian Wirth from the Clarity Group. Brian,
Hi, Joe.
welcome.
How are you? Thanks
Nice
for having me today. I appreciate
to have
it.
you here. Certainly. And I have to say something about this right from the very get-go. I'm a client of the Clarity Group. Yep. When I turned 65, I contacted Karen Olson from your group.
Yep.
And I was totally dumbfounded. I mean, my email and my snail mail at home was just full of different things, you know, with regard to retirement and all this. And I was just like, help, somebody help me sort this out. And she was awesome. And I think that the good thing, too, to refer to, you know, when we talk about the Clarity Group, is it's not a 1-800 number someplace across the United States where you don't know who you're talking to.
Yeah,
right?
so that's a big part of it. So obviously that issue that you were having when you were aging on, we'll call it, right, turning 65, that is, you know, what everybody's experiencing out there. There's reasons for that. It's a heavily compliance laden area, right? And there's that alphabet soup, I would call it, or the alphabet of Medicare, that A, B, C, D, and then even E,
Yeah,
right? So how is it that, you know, we would expect our aging population to kind of know and how to navigate that? But certainly what we do is we have that local feel, right? We're right in Western New York, in the heart of Western New York, and then also you know, our agents travel. So we're always making sure we're keeping a touch point for the Medicare beneficiaries as a whole. We're keeping a touch point in being able to get out and see them individually.
You know, one of the other things, you talk about A, B, C, D, whatever, but the other thing is Medicare, Medicaid.
Yeah.
And it's confusing for people. I mean, you know, which is which? We're dealing predominantly with Medicare, which is when you age, right?
Yeah, and that's the federal program. So, you know, as we begin to age, we get to 65, let's say, for a typical individual, they're automatically going to get Medicare Part A for their working years, and they're going to be able to choose if they want Medicare Part B, the doctoring side. That comes at a premium, right? So that's a bit of a high-level view of the Medicare, the federal side, but then you have the Medicaid side, which is the New York State side, and that's for lower income individuals, lower resources, and they do actually work together if you know how to navigate the space, and it's a great space for those people who are in need of extra services with Medicare and Medicaid.
You know, when you start talking about different options, I just didn't even realize. I'm sitting here and I'm going, you know, when I turn 65, what's going to happen? You know, what happens if, you know, I'm still employed? Is my employer at that point going to still, you know, cover my hospitalization or health care or whatever? Or am I going to look at a different plan? The other thing I want to make sure that I mention, right from the get-go, is there was no charge for me using the Clarity Group, or for anyone that's going to use the Clarity Group. For that matter, right?
So that's a big part of it, right? So we do not charge for our services. They come at, free of charge to everybody that we're able to help in the Medicare space. You know, I think that I'd like to kind of dive into transparency a little bit. You know, what I'd like people to realize is that at Clarity Group, what we do is we really assess your needs. And after assessing your needs, we try to find a suitable plan for you where you belong, quite frankly. And then that service doesn't end at that point. We're also looking into the future when somebody, you know, has changing needs, which we all do in our healthcare journey, right? We'd be able to reassess the situation and possibly even in the middle of the year find a special election period in order to actually help them with their new needs, let's say.
You know, one of the things, and I kind of liken this to insurance, because, you know, insurance, you can have an agent and you can have a broker, right, that deals with multiple agents.
Yep.
When I met with the Clarity Group, speaking specifically in my instance, when I met with them, I said, you know, here are my doctors, you know, here are the things that I need, my medications, whatever the case may be. And they came back to me, Clarity Group, with options.
Yes.
And said, you know, you can take this, this, or this, but the ones that would most meet my needs.
Yes.
The doctors, you know, the groups that were available, the medications that I needed, the services I needed, things like that. That was, you know, you did all the homework for me.
Yeah, so I don't think that I can even tell it as eloquently as you, right? Because you're living it. So that is exactly what we do. We make sure that we give all of the options that are out there, you know, based off of what the health assessment or health needs assessment might tell us that where you belong. And we also do resource assessment as well. And then we help you to choose that plan that best fits you. And remember, there are changing needs, as I already previously said, so we're making sure that they continue to fit you into the future as well.
If someone is going to approach the Clarity Group, what information should they have with them when they talk to you?
So we would always ask for you to come in with your doctor's list, right? And we'd also be asking, how many times are you seeing the doctors? And then also make sure you bring along a pharmaceutical, your prescription medications list as well. That's obviously very important. Those are two very big costs, in this space. So we want to make sure that we have those covered and that whatever it is that you need is covered.
What about key dates for individuals?
So key dates, number one, what consumers are going to be seeing coming up here at the end of September, let's say, they're going to be getting the ANOC, which is an annual notice of change from their current plan if they're already on a Medicare Advantage plan. Past that, October 1st, okay, we're able to market the plans into 2024, and then October 15th through December 7th is the annual election period, and that is the point where you get to choose a plan which will then take effect on January 1st of 2024. But remember, this is not just locked into what we do during annual election period. We are an all year round service with special election periods that might be available, or for those individuals like yourself who is aging on.
Also, I want to mention that each year, Karen from your group calls me and says, we're coming up on a new year. Let's review your plan and see if it still meets all your needs.
Yes, that's a big part of what we do. It's because it's a continued service, right? You have to understand that in this space, you were talking about agents and brokers a little bit earlier. In this space, we're able to offer you multiple carriers with multiple plans, right? We're not trying to steer you in one direction or another. It's really about your needs and where you fit, right? So, and then we're also compensated in such a way that we service you through the entirety of you having a plan with us. We are your agent of record. We're able to help you navigate that complex space of your health care on the health insurance side.
And where are you located here in Western New York?
So we have 5 locations, okay? One of them's brand new. Our brand new location is going to be at 404 Center Road in West Seneca. We're also located in the McKinley Mall in Hamburg. We have the Boulevard Mall, and then we have a Batavia office. And then we have our home office, which is Transit Road in Depew. It's 4976 Transit Road.
All right, Brian, thank you very much. For more information and answers to your questions, contact Clarity Group by calling 716-393-3437 or go to claritygroupny.com. Sponsorship and promotional consideration for the preceding segment was provided by the following.